Do you think OCD is just about being super clean and organized? It's not. Hi everyone, I'm Priyanka, your psychiatry faculty, and in this video, we'll explore the real meaning of OCD and we'll walk through the classic OCD cycle step by step. Now, what is OCD? OCD, also known as Obsessive Compulsive Disorder, is a psychiatric disorder or mental health disorder which is characterized by obsessions and compulsions, or either of these. So, what are obsessions? Obsessions are the intrusive, unwanted, and repetitive thoughts, urges, or mental images or doubts. So, thought that this table that I've touched is contaminated and because of the germs I may die. Urges, mental images, and doubts. Now, these repetitive, intrusive thoughts will usually be accompanied by compulsions. Compulsions are known as repetitive behaviors or acts. So, for example, if I have a obsession of contamination, so I'll be repetitively washing my hand. Now, these are done in response to an obsession, as we have discussed. Compulsions are usually rigid, rule bound. They are in a rigid and rule bound way. For example, if I have an obsession of contamination, so I'll be washing my hands for it. Now it is rule bound. For example, I'll be cleaning my hands 3 times, then only it will be considered dirt free or germ free. Now, obsessions and compulsions usually come in a pair, but not always. Sometimes obsessions are accompanied by avoidance behavior. So if I have the obsession of contamination, I will avoid going to the public washroom or such areas. Now we are clear with obsessions and compulsion, and we will finally move on to the OCD cycle. Now, what is the OCD cycle? In OCD cycle, first we have obsessions. So obsessions are the repetitive thoughts or mental images or doubts, for example, contamination, pathological doubt that I forgot to close the door or I forgot to turn off the knob, intrusive or forbidden thoughts. So these thoughts are usually sexual or violent thoughts. Then symmetry or need for order. So these obsessions are written in the particular order. So contamination is most common, pathological doubt second most common, intrusive or forbidden thoughts third most common, and then symmetry or need for order. Now, because of these repetitive intrusive thoughts which we don't want, there will be anxiety because of distress, fear, worry, and disgust. So these emotions, these are like a false alarm, and this false alarm, our brain keeps ringing and the patient feels a need to act because of these thoughts. Now, patient attempts to neutralize and suppress this feeling or this urge to act, but when the patient fails to suppress or neutralize this feeling or urge, there occurs a compulsion. Now, compulsion happens in the form of cleaning or repetitive cleansing, checking the stove, door, etc., or your wallet, then or arranging or ordering things in a particular order, and mental rituals like praying and counting. So these obsessions and compulsions occur in a pair. For contamination, there will be cleansing. For doubts, there will be checking, and so on. Now these compulsions, so patient ends up spending majority of the day performing the compulsions, and hence there will be an impairment in the occupational, social, and personal life, etc. Now, after performing these compulsions, what happens is patient gets a temporary relief in this anxiety. But this relief, I repeat, is temporary, and once again the patient gets obsessions. Now, this is a vicious cycle in which the patient gets caught, and this is known as the OCD cycle. I hope you are clear with the concept of OCD, and for further videos for related to OCD or other psychiatric disorders, kindly follow or subscribe the channel and give a thumbs up for this video. Thank you.